It is 11 o'clock, and I would like to suggest that we start. Good morning, everyone. My name is Bongi Wendondo, and I'm with Hlanganisa Institute for Development in Southern Africa. I also serve on the board of SAPA SA, and I'd like to warmly welcome you to our webinar today, hosted by SAPA, Sonke, the Medical Research Council, and Hlanganisa. And today we're going to be talking about one of the most topical issues in the last 2 years, which is alcohol regulation and what it can or cannot do to our public health policy, to our public health scenarios. And what we're going to do today is listen to a research study that was done towards the end of 2020. And we will have very esteemed colleagues respond to that research piece and talk to us about how those findings translate into some of the community interventions that they are busy with. I would like to introduce to you ahead of time our panelists. So we've got Leanne Ramsuma, who is with the Medical Research Council, and Leanne will be taking us through the research document and highlighting, some of the important findings from the research. We will also have Nelisiwe Hlophe. Nelisiwe is with the Soul City Institute, and she will be taking us through the research findings, but with a very fine brush, looking at young women in particular. So through the lens of young women in South Africa. We also have Lebo Ramafuku, a renowned activist in the space who is with Tekano, and she will be taking us through the findings just from a health equity perspective, but also looking at social accountability and what communities can or cannot do in light of these findings and in light of some of the issues, sticky issues in relation to alcohol regulation. So I want to welcome all of you colleagues, the three of you, and look forward to your exciting contributions to this discussion. Just to give a bit more context before I hand over to Leanne. So this is a research piece that was done towards the end of 2020 and involved 4 countries, South Africa, Botswana, Namibia, and Zimbabwe. And it used an ecological approach to looking at the drivers of gender-based violence. And I think it gives meaning to this period, as we commemorate the 16 days against violence against women and children. And I think it gives life to the conversations that we've been having, since 16 days started, as we reflect on some of the key drivers of gender-based violence and intimate partner violence in particular, and look at how we can combat those as a country, but also as a region. So the richness of this study is that it brings a regional or a multi-country perspective, and also allows us to, sketch a picture both comparatively but also collectively amongst the 4 countries. So as we, as we start, we're clearly in the middle of a lot of things. We're in the middle of COVID. We're in the middle of Omicron. We don't know whether we're coming or going. It's quite a bleak place we're in as a country and as a region, in relation to COVID, but also in relation to just public health issues in general. So I think it's well worth noting that, this research was done during a time in the middle of our COVID pandemic, which we are still in the middle of, but also at a time when the South African government in particular had introduced some restrictions around availability of alcohol in the form of, limited trading hours. And so this study gives context and draws on and leverages, some of the real life experiences we had during that time, because that opportunity, those restrictions presented an opportunity for us to almost have a natural experiment, where we were able to compare the pressure on our health systems as a result of gender-based violence, and link them directly with the availability or unavailability of alcohol within our communities. And I think that's important. So without unpacking too much of what the study has, or of what the findings have for us, I would like to hand over to Leanne. Like I said, Leanne Ramsuma is with the Medical Research Council, and she will take us through the crux of the study and present the findings that we will all then have an opportunity to engage around. Leanne, over to you. Thank you.
Thank you very much, Bongi. Thank you to SAPA, to Sonke, to Ford Foundation, and of course to our partners at Hlanganisa, as well as at Soul City, Tekano, for joining. And especially thank you to you for joining this webinar this morning. I'm going to actually go straight into the evidence around the issue of alcohol availability in particular, as well as its link to gender-based violence. And I've been very fortunate in the last few years to be working directly in the gender-based violence space. And a particular area of interest for me has been looking at the intersection of alcohol use with gender-based violence. So colleagues, I want to start by just acknowledging that alcohol use, and particularly harmful alcohol use, has been globally recognized now as a driver of gender-based violence. And this includes both intimate partner violence as well as non-partner sexual violence. But its role has, excuse me, for a long time been contested. And in some quarters, there's still reluctance to accept that alcohol plays a role in gender-based violence. And this is largely due to a perception that this would lead to alcohol being blamed rather than the perpetrator. And so while we recognize that, in fact, there are men, particularly, and women who either perpetrate or experience violence who do not consume alcohol, and also that those who do consume alcohol may not necessarily perpetrate violence, what we do find consistently from the research is that among those men who have reported perpetrating violence and women experiencing violence, there's almost always been reports of alcohol use, and particularly harmful alcohol use. There's also been a debate about whether it's just drinking that leads to risk for gender-based violence, or whether it's alcohol abuse and dependence. And results from a 30-year longitudinal study have actually found that women were at twice the risk of experiencing gender-based violence when she was in a relationship with somebody who had been alcohol dependent. I recently conducted a pooled analysis of the role of alcohol use in gender-based violence, that's both IPV and non-partner sexual violence, and found that, and this occurred across 5 settings in 4 African countries, different to the ones that I'll present in a little while. And without exception, there's an overwhelming increase in risk for perpetration of violence and experience of violence in the presence of alcohol use. So the evidence is clear, not just from recent work, but from work that's been done now in the last 2 decades, looking at the role of alcohol in gender-based violence. We also know that globally 35% of women report having experienced either IPV or non-partner sexual violence in their lifetime. And 43% of the world's population consume alcohol. Closer to home, 32% of the African region drink alcohol. And among those, we have 40% who do so in what we call a heavy episodic manner. And this basically means that people consume 5 or more drinks, or about 60 grams of alcohol in one setting in the last month. And you'll see as I go to present the prevalence of these different issues, that we are a nation and certainly a region that is characterized by heavy episodic drinking. So when we take a public health lens to the issue, we can see that both harmful alcohol use and gender-based violence are significant co-occurring and intersecting public health problems facing the region, the country, and certain parts of the world. The overarching document on addressing and responding to gender-based violence, which is the National Strategic Plan on Gender-Based Violence and Femicide, that was recently developed and publicized after the high-level presidential summit, recognizes the intersecting role of alcohol abuse with gender-based violence, certainly in South Africa. So this figure looks at alcohol use and gender-based violence in the 4 sub-Saharan African countries that we looked at for the review that I'll talk about. These countries were South Africa, Botswana, Namibia, and Zimbabwe. And if you look at the figure, you'll see that there's a similar prevalence of drinking across most of the countries. And there's also a similar and worrying pattern of heavy episodic drinking across the 4 countries. And while we looked only at these 4 countries, I can tell you from other work that has been published and I have been involved in that this does reflect a pattern of alcohol use in sub-Saharan Africa, one that is characterized by heavy episodic drinking. When you look at GBV, you'll see again that there's a similar pattern of gender-based violence across these different countries in the region, except in Botswana, which is overwhelmingly higher. And the reason for that is that there hasn't been a recent DHS done in Botswana. And so in the absence of a DHS, they have relied on the GBV indicator survey, which found 67% of gender-based violence prevalence in Botswana. The other point that I want to make about this is that although we rely on DHS data in country to report particularly on gender-based violence, we have seen in other research in subpopulations that these national statistics can sometimes mask the variations in subpopulations. So in some informal settlements that we've worked in, we have seen up to 60% of gender-based violence occurring, that's perpetration of gender-based violence occurring. And so we need to consider that there will be variations in different populations, and in particular, that these variations often reflect a higher level of gender-based violence. So with that, it's critical to understand the drivers of both gender-based violence and alcohol use in these settings, and to begin to address them as co-occurring and intersecting problems. So any effort to prevent gender-based violence must begin with an understanding of what drives it. And as you can see from the socio-ecological model, which Bongi had already introduced you to, that there are multiple drivers that exist at different levels to impact on gender-based violence perpetration and on the experience of gender-based violence. And this is not a new model. It's been used to understand, identify, and address different drivers across a range of health issues. From this, you can see that at the individual level, so an individual consuming alcohol can impact on the on inhibition, and we know from previous physiological work as well that alcohol has a disinhibitory effect on an individual when drinking, and this impacts on what happens at the relationship level. So we found in almost all the GBV research work that we've done locally, and more recently from a body of global work that we've been doing, that partner alcohol use and other substance use actually emerges consistently as a risk factor for violence in a relationship. And this happens because when alcohol results in a disinhibitory state, this can often escalate into quarreling and into violence, especially important when couples drink. And this is an area that we really need to be looking at as researchers, is what happens when people drink together, an area that definitely needs further exploration. And so what can be what we call daily hassles or triggers for a conflict in a relationship, such as money spent on alcohol, household distribution of work, etc., can very quickly escalate into violence in the presence of alcohol use. We also know that drinking alcohol at a community level is normative in the region and in the country. And that alcohol's availability, its easy access and affordability through the number of alcohol outlets that we have and the density thereof, as well as the number of unlicensed and illegal outlets in the region, means that alcohol is easily accessible to people. We also know, particularly at the local levels, that there's a lack of implementation of laws, and we'll talk a little bit more about that later and in the discussion. So we need to be thinking about a holistic understanding of gender-based violence and of the intersecting role with alcohol. And I want to say that they're often, if you look at it, they're often common drivers of alcohol use and gender-based violence, particularly around structural issues. So when we talk about structural interventions, we're mostly familiar with things like taxation, pricing. There's been repeated calls for minimum unit pricing, distribution, etc. And we talk about addressing alcohol availability. So with this in mind, we undertook a review to assess alcohol availability based on two indicators: alcohol outlet density and outlet trading times. And really, the issue of addressing alcohol availability is designed to make alcohol less available and affordable to the general public. It centers on one of the WHO's recommendations for structural interventions to reduce harmful alcohol use, and is considered among the best buys to reduce harmful alcohol use because it's both cost-effective and it's feasible to implement at population level. But although structural interventions have been in place globally for a long time, and there's been several debates around it, which we'll get into later, we find that structural interventions, in particular in the sub-Saharan African region, have been varied. They've been inconsistent, and they've been challenging and fraught. And so we need to be looking at how do we address alcohol's availability in the region. When we took a look at the 4 countries under review, we considered also the policy and legislative frameworks in which they find themselves. And what we found was that for most of the countries, including the 4 countries that we reviewed in detail, they have various international and national level policies and interventions in place to address both alcohol use and to address gender-based violence. And these include CEDAW, where they include the Beijing Declaration, they include the Global Action Plan to Reduce Harmful Alcohol Use, initiatives such as SAFER. But often when we look at what's happening on the ground, we find that there are several challenges that impede meaningful and effective prevention and response through these legislative frameworks. So we conducted a review that followed the core principles of a full systematic review. We looked at work that was published in peer-reviewed literature or as international policy guidelines between January 2000 and December 2020. And we did include some exceptions, and I'll explain why when I get to that. We looked at interventions that measured intimate partner violence and non-partner sexual violence. We considered randomized control trials or quasi-experimental studies where there was a control group, just to ensure that we were looking at rigorous interventions. And we did look at systematic reviews of alcohol availability and/or alcohol availability and gender-based violence. This started as a global review, and then we looked within the region, and we drew on high-quality systematic reviews globally of alcohol and GBV to provide an overview of the evidence. But we zoned in on the African region and in South Africa, Botswana, and Namibia. And the details of this will be found in a larger report which has been developed. And so I will just go through some of the highlights of that report. So when we looked at studies, we first looked at studies that addressed alcohol availability. So alcohol outlet density and alcohol trading times and the use of alcohol. And we found from 13 systematic reviews that were based on 67 quasi-experimental designs that reducing alcohol availability by restricting alcohol outlet density and outlet trading times was associated with reduced alcohol consumption and its related harms. We included also 4 evidence reviews that looked at the relationship between alcohol and alcohol availability and its use. And again, we found that increased alcohol availability is associated with an increase in alcohol use. One umbrella review in particular found that when on and off-premise outlet density was restricted and sale of alcohol in both on and off-premise outlets was restricted, these could be potentially beneficial for reducing alcohol use and its related harms. So overall, there's good evidence from this section of the review and from the systematic reviews of the effectiveness of interventions to reduce alcohol availability, and that increased availability of alcohol through either increased alcohol outlet density and hours of trading time is associated with an increase in alcohol use and alcohol-related harm. We then went on to look at studies that addressed both alcohol and gender-based violence. And here we found 13 studies, of which 9 were randomized controlled trials or quasi-experimental studies. And again, they found good evidence from randomized controlled trials of the effectiveness of interventions to reduce alcohol availability and its ability to reduce both alcohol consumption and gender-based violence. Again, we looked at 3 evidence reviews, which found moderate to good evidence of different integrated approaches to address alcohol and gender-based violence. And these included brief interventions that are designed to work with people who present with alcohol dependency or harmful levels of alcohol on a continuous basis, interventions that use motivational interviewing, interventions that work with couples to address both alcohol use and gender-based violence in their relationships, and gender transformative programs, mainly that work with men to alter the norms around gender inequitability, as well as patriarchal privilege. And then we looked at one time series design that was longitudinal, and it found that increased alcohol outlet density was significantly associated with increases in domestic violence over time. And this was particularly the case for outlets that sold packaged liquor. So again, we concluded that there's good evidence from systematic reviews of the effectiveness of interventions to reduce alcohol availability, to reduce alcohol consumption, and to reduce the related alcohol-related gender-based violence. Specifically, we found that that evidence shows that working with couples to intervene on issues of alcohol abuse or misuse and violence in their relationships, and intervening with men through gender transformative programs is particularly beneficial in reducing both alcohol use and gender-based violence. And where there's good evidence for reducing gender-based violence through alcohol and or substance use interventions, these largely come from Southern Africa. But there's also a limitation of evidence for structural alcohol interventions via both alcohol interventions that are embedded in gender-based violence programs or vice versa. And so we need to be doing much more work around that. Based on these, we concluded, and we want to make a few recommendations for various different stakeholders working to address gender-based violence and alcohol use in the region. The first is for donors, and that donors do need to increase investment in research on the association between alcohol and gender-based violence in the Global South more generally. We've often, based on the reluctance to accept alcohol use as a key driver of gender-based violence, worked in silos. We've sometimes worked separately, and now's the time to come together and invest really seriously on looking at these intersections of these co-occurring problems. We need to be looking to fund the scale up of, of existing interventions that have been shown to work to reduce alcohol use and gender-based violence, such as those I've highlighted, which is couples programs and gender transformative programs. We need to be funding evaluations of multi-level and structural interventions to reduce alcohol use and all its related harms. And we need to adopt evidence-based approaches to fund integrated interventions to address alcohol use. For researchers, we must increase the rigor of the research. We need to improve the quality of routinely collected data by liquor authorities, particularly at the provincial level, and on alcohol outlet density. We have a proliferation of both legal and illegal outlets in South Africa and rather permissive trading times. So we need to collect data in a more robust way to strengthen the evidence base that these as structural drivers do impact on high levels of alcohol consumption and on gender-based violence. We also need to robustly design, implement, and publish qualitative research on how the regulations that are often not effectively implemented impact on the lived experiences of people, particularly in communities. And to understand how everything from disturbances to violence that might occur as a result of alcohol use is really experienced by people on the ground. And then we need to test best practice research and data collection methods to measure the effectiveness of structural interventions. As we've done with taxation and with policy and pricing, we need to be looking at alcohol availability. And then for implementers, people working at the coalface of this, we must sensitize communities to the association between alcohol use and gender-based violence. We cannot afford to continue to deny the role of alcohol use in gender-based violence, because the evidence base now overwhelmingly tells us that this is something we should be addressing, we should be targeting, and we should be integrating into our gender-based violence programs. We must empower communities with knowledge and skills to take responsibility and to collectively act on alcohol regulations within the communities, and begin to involve them in participatory mapping of data, both qualitative and quantitative data, to ensure that alcohol use is regulated in their communities, and to raise their existing agency that they are entitled to live in safe environments and communities. And we, of course, need multi-sectoral action for effective implementation around alcohol density, around trading times, etc. We need to break the silos in which we work and come together to achieve the shared vision of safer safer alcohol-free communities, or alcohol-healthy communities, and GBV-free environments. And so my last slide, I want to really make a call to action to all of us as researchers, as practitioners, and to donors, to really recognize that in the last 2 decades, there's been growing recognition and scientific evidence of the role of alcohol as a significant driver of gender-based violence. Our evidence review, which is available, reveals this association. And so we need to act urgently to address the intersection of these two public health problems by developing structural interventions, effecting policy and systemic change in tandem with a suite of other prevention interventions that have been shown to address harmful alcohol use. We will not optimally address these through single-level interventions. We need to look at and to fund multi-level and multi-sectoral interventions. And we must work together to measure, to adapt, to implement, and evaluate evidence-based alcohol abuse and gender-based violence prevention approaches, and translate this evidence for use in policy, programmatic, and donor decision-making. Thank you very much.
Thank you, Leanne. That took us on a very interesting and I think very telling story about alcohol regulation and gender-based violence. And I think, like I said earlier, this is really a good time to be reflecting on some of these structural drivers of gender-based violence as we commemorate the 16 days of activism against violence against women and girls. And I think where you ended, it is also a good place for us to start. Talk about now is the time to start putting evidence into practice. We already have the research, you've just presented the evidence, and what are we doing about it, or what are we going to do about it? one of the things that you point to is the issue of alcohol liquor density. And I was thinking, I was speaking to somebody who was talking about countries that have been able to keep their streets clean, to keep litter off the streets. And one of the critical interventions across all those countries has been the availability of dustbins at every turn, So you want to promote a behavior, you want to make sure that there's facilitators for that behavior. So you want people to put trash in dustbins, you make sure that there's lots and lots of dustbins. So for us, when you look at the alcohol density, the alcohol outlet densities, the question that we need to be asking is, what behavior are we trying to promote? Because in our communities, at every turn, there is an there's a liquor outlet, whether licensed or unlicensed. So what behavior are we, whether, deliberately or inadvertently, promoting, with all these alcohol outlets all over the place? We do know, and I'm coming to Nelisiwe, so that she gives us a bit of perspective. We do know that the alcohol industry in the last few decades has been quite deliberate and purposeful around targeting women and young women in particular. And if you look at a lot of the marketing that's been going on around flavored drinks, around, the advertising about, how that links lifestyle, to certain, drinking behaviors, it's clear that, there's a real effort to get the market share of young women. And so, Nelisiwe, as an organization that works with young women, I would like you to reflect on the findings, but also give us some perspective on what you think might be happening with alcohol liquor, regulation and policy. And in particular, I want us to think about whether or not there is scope, for looking at regulation that targets specific age groups, based on the vulnerability that we're seeing coming across, whether it's, young people in general or young women. What can we do from a policy perspective to ensure that, we accept and, the differential vulnerability that different groups present with? Nelisiwe?
Thank you, Bongi, and thank you to our partners, Mailen Guardian, Hlanganisa, Ford Foundation, and SAPA. Thank you for the opportunity. Maybe to start my discussion or presentation, I will narrate 3 scenarios. In our work as Soul City Institute through Soul Buddies Club, we had embarked on an alcohol-free schools campaign where we were encouraging children who are part of our program to identify, alcohol outlets around their school to, to see if they are regulated. So one of the schools in Soweto identified that around the school, they have a tavern. And after school, a number of children have reported being raped by the people who are drinking at the tavern. I think at that point, there were about 10 cases that were reported in just that one particular school and around that particular tavern. And what happened through our support and the support of the school, we embarked on a campaign where we worked with the local police station, we worked with the communities to address the issue with the tavern owner. So obviously the tavern was not regulated because it was 200 meters away from the school. So it means that some of the, the reinforcement of laws is not happening, particularly in our Black communities, your township, your rural, and your informal settlements. So it was through the community action that the tavern owner was forced to open later in the day at 9 when kids are at school, and to close the tavern around 1 o'clock when the kids are going back to school. Another scenario is when we worked in Olive Wardbush in Tshwane, where we spoke to young girls between the ages of 15 and 18 who were part of our RISE programs. And what the feedback that we got from them is that they try to keep safe and they try to walk in groups, because as they go home, they will pass more than 3 taverns in their street. And normally what happens is that people who are drinking in those taverns will target them. They either kidnap them or, they could be victims of rape. So to protect themselves as young girls, they ensure that they have to, walk as a group to ensure that they are safe. My third scenario is in a rural community in KZN, in Ilembe district, around Indwedwe area, where one of our RISE clubs identified that there's been a number of girls also who have been raped around the tavern that is next to their school. And their role was to try and do an advocacy campaign where they will, engage the councillor in the community, engage the local chief, and engage the community to say, can this tavern be closed? Because you have cases where girls have reported rape by the people who are at the tavern. And I think in that particular community, there was even a bush where, that was close to the tavern. And for me, it just shows then that in our country, first of all, in terms of the licensing reinforcement, we know it's not done properly. We still have taverns that are very close to schools and they are not regulated. So we need to address that part. The second part for me is that with the third scenario where the girls wanted to do an advocacy campaign, they felt unsafe. They couldn't continue with their campaign of engaging the community, engaging the councillor, engaging, the owner of the tavern, because they were threatened by the tavern owner. And they knew that the tavern owner is linked to some, big political party in the area. So they had to stop their campaign in trying to address that issue. So for me, it then says that our communities sometimes they feel powerless because, these laws that are supposed to protect them and reinforce some of the liquor regulations are not, reinforced in the communities. What we have seen that, if you look at the impact of rape, the impact of, sexual violence, it has long-term, trauma on an individual. And what's still an issue in our communities is that there are very few services where these young girls can go for psychological support or for psychosocial support. So we also need to look at the impact at that level. We also I wanted also to touch on the issue of parenting and communities, taking part. I think the first speaker already highlighted the issue of an integrated interventions in addressing those issues with community members, parents. What also came out from our programs is that a number of children, a number of young girls are exposed to alcohol at a very early age. You will find a 5-year-old girl, for example, being sent by a guardian or an adult to go and buy alcohol, in the neighborhood. So it just shows that the study, what has been said in the study is that it is really happening in our communities. We still have a number of alcohol outlets, and there is no reinforcement in terms of, the licensing, in terms of the age even. A number of these outlets, they will still sell alcohol to children, and children under as young as 5 years old. So for me, and I think as an organization, we recommend that we really need to look at community-based interventions where communities, parents, and the key stakeholders like your local police could play a role in regulating, access to alcohol, but also know the impact that alcohol has on the young girls and the children in the communities. What we have also seen as a trend, which also touched to your point that you raised around the advertising. There's been a lot of advertising of alcoholic drinks that specifically target young women and making alcohol, as an option. As a result, a number of young women are actually also drinking a lot of alcohol. If you can go to the townships or even in our communities, you will see that a number of girls are actually drinking alcohol, and it makes them vulnerable, their safety, to abuse and to being violated. But also what we have also learned through our intervention is that some of the girls are actually using alcohol as a coping mechanism to deal with their traumas. So a multi-layered interventions and programs are quite critical, starting at individual level to address, issues, and also to look at how do we promote positive role models in our own communities, in our own families, and how do we, equip parents as well in terms of, parenting skills and communicating with the children and ensuring that children are not exposed or they are not sent to go and buy alcohol, in their communities. So those are some of the things that I think as an organization we have picked up, and I think in line with what has been presented from this study, that an integrated approach, a community-based approach, and that we need, law enforcers to reinforce the licensing in terms of where are these alcohol outlets are.
Thank you.
Because I think in that point, before I stop, is that if we also look at the issue of inequality. If you're looking at your very urban areas or your more, affluent areas, there's regulation. But when it comes to your informal, your township, and your rural communities, there is no reinforcement. So it shows that also there's inequalities around in our communities around those issues. So it's a issue that needs to be looked at various levels and ensure that the different stakeholders are accountable.
Thank you, Nelisiwe. Thank you, and I think that's a good a way to end. Where you're asking the question, where are our law enforcement agencies? When we need them at this critical time. We are out of time. I would like us to respond to some of the questions that have been posed by our participants. But before I go to the questions, I just want you, Lebo, to starting from where Nelisiwe was ended. She says, where are the police? I want to ask, where are our communities? And what kind of what can we do as communities? Are we as helpless as it seems, as we seem to be? Is there anything at all we can do as practitioners working in this field to support communities to take control? Because alcohol has been around since time immemorial. Our cultures, in our cultures, we celebrate with alcohol, but we've never seen the kind of, abuse and misuse that we're seeing, especially among young people. So where are our communities, Lebo?
Thank you, Bongi. Thank you, Leanne and Nelly. And thank you for all the organizers and supporters of this very important conversation. When I listened to what Leanne was saying and coming to your question, I think there is one thing that did not come out that I want to put onto the whole issue. And it is the power that the alcohol industry holds and the manner in which they operate. And any intervention that we have, whether at a community level or even at a national level, that does not unpack these power imbalances around all the actors that keep communities consuming alcohol, buying alcohol, and do not really come together to unpack these power relations, we are going to find ourselves asking communities that are already traumatized by external power to find solutions that may be well-meaning but may not be everlasting. And when I talk about power, is that let us acknowledge that the alcohol industry, in a lot of ways, and we have seen how in some instances when activists have argued for tighter regulation, they have spoken about self-regulation. how in many countries they have even started agencies of self-regulation where they are basically saying and using our own language as activists that no, we are also worried about the misuse of alcohol, and how they have then used their power to shape the narrative in a particular manner. So even in some of the chats right now, I have seen other people saying, you know, if people do not know how to handle alcohol, so they are leaving the responsibility at the individual level and at the community level, and take no responsibility in actually even calling alcohol a drug, and understanding that when you are, you know, we've seen how even with marijuana, we have had years and years of saying, why are you not legalizing it? How that language and that narrative has almost absolved them from the responsibility. And when communities do not then understand these power dynamics with an industry that spends billions, particularly around the festive season, to make sure that we consume alcohol, how the industry has used their power to take all male and now female stars, people that are seen as stars in today's language, they are called influencers, and really associated success with alcohol. We are going to leave communities to really try and deal with the repercussions of alcohol, and rather than understanding, you know, these power relations. I think, Bongiwe, what we need to do, and what is for me the benefit of this study, is that more and more we are collecting the evidence that is necessary, that communities themselves can use to hold those that are in power accountable. And maybe when we are in the conversation about power, one of the things that we can do is to try and work with communities to understand where does their power lie. Now, we all know that in all communities, there is the integrated development plans. So how are we going to work with communities and community structures to use the integrated development plans to start saying, in our community, this is how, you know, we would like the money to be spent, and this is how we want policing to be spent. How do we then, and I liked what Leanne was saying, to really say, what can implementers do? What can communities do? What can researchers do? But I think also what we see that is missing, and I basically spoke about it, which is already what research can do. And I wrote in my notes that perhaps what we must also talk about is using research or conducting research that people or communities can use. So in every community, for example, there is a school and there are stories of trauma. How are we supporting communities as people who generate the research and use that research to basically create stories? How are we using community radio stations, for an example, to talk about the impact of alcohol consumption in their communities? So one of the stories that most probably a lot of us, particularly in South Africa, could resonate with was the story of healthcare workers telling us that for the first time on New Year's Eve and New Year's Day last year, there were no trauma cases. That was a story that for me, and I believe a lot in narrative, is so important to tell. And similarly, how are we engaging communities in research so that they can use the stories, they can collect data of the cases that are seen in their clinics, they can collect data of community-based monitoring, which is activities that Soul City has also participated in before, in mapping all the taverns, both legal and illegal, and engage communities in dialogue. But as we do so, I think when we unpack the issues of power, we also need to understand at tandem how the alcohol industry works. And I think there is a lot of lessons that can be drawn from the tobacco industry. We saw how the tobacco industry also used research and researchers to say, well, there is no evidence that says smoking leads to lung cancer, and that if you stopped smoking, we are seeing the same. And I think with social media and the advent of fake news, we must also contend with the fact that these are the tactics that the alcohol industry uses.
Right.
And I think our responsibility and our duty when we work with communities is to unpack the power imbalances, also talk about the history of alcohol in African communities. You ask about we celebrate with alcohol. Now, in the past, when we had to do home brews, it was very clear, although patriarchal, who can partake and who cannot partake. We know that with the history of apartheid and the history of beer houses, which persists, by the way, you find an Ngoto in Philippi, in Khayelitsha. You don't find it in Camps Bay and in Sandton. So when communities understand how the alcohol industry works, I think for me, and understands the power dynamics, who has which power, and the instruments that happen at communities, and the power of communities themselves to collect this story and to call the different local government. I mean, we are at a moment in history in South Africa as flawed and as mangelmoes, if anybody understood that word, where the scales have shifted in local government. In every interview I have given around 16 days, I have said to people, 51% of registered voters are women. So if the local government elections are anything to go by, shouldn't we be preparing ourselves right now? One, to really look at the current coalitions and make alcohol availability in communities a major issue that we want many of the communities to advocate for. But more importantly, to make it a 2024 campaign. And right. It will take qualitative research. It will take us collecting stories. It will take us looking at the differentials of what is acceptable and available in an affluent suburb and what is available and accessible in terms of alcohol, and really begin to make the argument, right, around how we deal with alcohol. And I think for me, it will take the argument from the harm more to what is the power that is there and how it is used by various people, and using narrative and research to drive that agenda.
Right. Thank you, Lebo. Sorry, we're out of time, so I was trying to intervene there. But just picking up from one of your points, Lebo, you're saying let's not be silent about the power that the industry yields, right? And my question, which is a question from the Q&A session from one of our participants, is how do we hold the industry to account in a context where there isn't any harmonization of laws within our own system? We can't agree what the minimum standards are. We can't agree. We've got different bylaws for different cities, for different towns. And many of those are not even aligned to what is prescribed at national level as minimum standards. So how do we hold this very powerful and very notorious industry to account if our house is not in order? And maybe, Leanne, you can answer that, and perhaps Lebo or Nelly, if you have any comments about the harmonization of laws from local, provincial to national.
Thanks very much, Bongi. I mean, I think you've given me one of the harder things to address, but it's also something that I have been confronted with in the last particularly 10 or 11 years, is we simply have not managed to ensure that we can get a simple task like harmonizing alcohol policy and regulations across this country right. And, I didn't get a chance in my slide to talk about the issue of how and where, we have seen the policy and legislative environment, because that's essentially what it is. We are hamstrung by so many different things. And Lebo is absolutely right when she talks about the alcohol industry. But there are political delays that have resulted in us now sitting with a range of different policies and regulations being implemented either not correctly, or you have different laws and you have different regulations and bylaws, as you mentioned. So, for example, one can sell and purchase alcohol in one community. Sometimes it's even disaggregated within a particular province where some municipalities have a bylaw and others don't. And we've simply not been able to get that right. It's not something that should be taking such a long time. The delay in the adoption of the Liquor Amendment Bill is something that has continually been put on the agenda of policy and decision makers. But again, there's a very interesting and unhealthy relationship with the alcohol industry. And so the liquor amendment that was basically passed by cabinet in 2000 was approved by cabinet in 2016 after extensive public participation, after 2 regulatory impact assessments. The alcohol industry then called for another impact assessment. And the bill has been in abeyance now since 2016. And I can tell you that as researchers, as practitioners, as advocates, as lobby groups, we've been asking repeatedly for this to be brought back on the agenda. We're not asking for anything that is not according to global standards around regulating alcohol. We simply can't get it right. And until we are able to get the political will to break unhealthy relationships with the alcohol industry and to say enough is enough, and people have a right to live and to work and to play in alcohol safe zones. We're not calling for prohibition, but in alcohol safe zones, and to really give people the opportunity to say, we have agency as communities, and we actually can choose who we vote into power, and that those people work in the best interests of our public health. We've not been able to do this. The fight continues, and certainly in my role as a researcher, I will continue to remain committed to producing the evidence, particularly as the call from Lebo and others have come around the qualitative experience. How is this impacting on the lives of people who have to live this every single day? So
it's research piece after research piece, and depending on who's asking the question, you could arrive at a different answer. If the industry is asking the question, how they frame it, what data they collect. So it's a contestation. It's a contestation all the time, and maybe this is the nature of our lives. Lebo, do you want to just comment on the harmonization of laws before I speak to something different?
So I think Bongiwe is the same thread about, are we giving communities this research to ask elected officials the question? How do you have an alcohol bill, particularly if we elevate the stories of trauma and of harm, and communities come together and they use this research and they use their power coupled with the power of the research to ask politicians the questions. I mean, one thing that the alcohol industry has done is that it has used the very few people in the community, those who sell alcohol, to build their story. So it is not the industry that is going to take a radio interview or a television interview. It is the taverner who says, but my livelihood and my children. So I think there are a number of tactics ourselves. Rather than talk about research as research, I would say, how do you take that research? How do you take the qualitative stories? And how do you give community that says, why in my community am I not having the regulations that are available in the other community? Do our communities even understand about the liquor amendment bill and what it was meant to do? And I think maybe the last point I want to add is that if we are then going to talk to donors, the work of building movements that will support communities for sustained action, because the alcohol industry thrives on the fact that they can out-budget you. You know, they can have so much money where every point you put, they can counter. So where are we seeing the kind of support for communities to continue giving this point? And elections, for me as a South African living in a democracy, I want to use my vote to advocate for the things that I care for. And community-based monitoring is the kind of research that I want that will help me then say to those that want my vote, what are you going to do with this? And what are the commitments that you are giving? And I'm sure even within government, there are allies that we can work with to achieve this.
Yeah. I mean, it's a pity that government is not represented on this panel. It would have been very, instructive to hear what they have to say about the harmonization of laws, because it's clearly within our ambit, right? I do want to ask the question, and perhaps Nelisiwe, you can come in. When we talk about violence, often we talk about physical violence, but there's a lot of other violence that's been perpetrated against women, that doesn't necessarily take the form of physical violence. To what extent are we in these research pieces and in the conversations we're having, to what extent are we capturing that violence? You might be muted, Nelly.
Yeah, I realize. So, Bongi, I think you are right. I think sometimes when we talk about violence, we always think of physical violence. But I think, as I mentioned in the scenarios that I mentioned, is that there is also a lot of emotional violence that happens as a result of that happens and perpetrated to young women. Also, sexual violence is one of the highest form of violence that also happens as a result of alcohol abuse. Especially when you look at children and young women, they are exposed to those kind of violence. As I mentioned earlier, and I think we need also to look at how do we work with young girls, but also working with communities to ensure that people get help and support that they need. Just also going back to looking at the legislation is to also ensure that within our communities we look at the safe spaces where our young women, or generally children, use. How safe are those spaces? And there are interventions that can be done to ensure that children and young women are safe. Or also in terms of regulating the tavern opening and the liquor outlets opening and closing, so that we minimize vulnerability, but also minimize unsafe circumstances around adolescent girls and young women.
Right. Thank you, Lebo. I see that thank you, Nelly. I see that we are out of time, but I just want to squeeze one last question, and perhaps as you reflect on it, I'll give Leanne an opportunity, and Lebo, and please use that also as your final closing remarks. The issue of conflict of interest, to what extent do we understand how conflicted the industry is in being in the same room as practitioners and communities and government trying to put together and agree on regulations? And I say this because we talk about recommendations to researchers. There are some researchers and within academia who are taking money from the industry, and don't understand the conflict of interest issues. And similarly, we've known of government departments taking money from the industry, and clearly there isn't sufficient appreciation of the issues around conflict of interest. Do you want to take a step, Leanne, as your final closing remarks, and Lebo following on that?
Thanks, Bongi. I think history has shown us that the alcohol industry there's an incredible conflict of interest. And, as a researcher and part of bigger alliances, etc., we've taken a decision, for example, never to work with the alcohol industry, because we've seen how so much time, money, and energy is put into rebutting the reality of what alcohol does to individuals, to communities, to children, etc. I, for one, don't believe that there is good intent. I know that there are for-profit industry that will continue with several tactics already raised by Lebo, targeting young people, targeting women, trying to tap into what they called the potential of the African market. And none of that is anything that is honorable. And so I can't see how their presence in decision making, and as I mentioned, the unhealthy relationship that they have with our government and with our decision makers is ever going to create a space where we can enter into a meaningful discussion with the alcohol industry. So I'll stop there.
Yeah, I don't see Bongi, but to add, Leanne, my point is it's a slippery slope. I think once you enter into the room with the alcohol industry, once you take money from the alcohol industry, you do that very naively. And I'm sure they want to be in the room because the only way that they can have control is when they are in the room.
Yes.
So I do agree with you that, in fact, it is being extremely naive to think that you can sit. And I think, again, I'll go back to the issue of power. I don't understand how the state with legislative power, the state with a budget, may think that they need the budget and the funding from the alcohol industry. There is no free lunch. So when you take it, you need to understand that you are compromising yourself. You know, and quite honestly, it's as simple as that. All other arguments I have seen or heard about departments, about other organizations taking money from the alcohol industry without even wanting to recognize that you are being bought in one way or the other, you know, shows just our own naivety. There is a lot that we can learn from the tobacco industry around the tactics of industry, big industries, when activists and communities want to really pinch them in their pockets. The alcohol industry is not a charity organization. The alcohol industry pays bonuses and dividends and sit very pretty, not even in South African markets. Even SAB is not even in South Africa. You know, when we consume alcohol, their concern at the bottom line is that we consume alcohol and we don't hold them responsible for alcohol harm. So there can never be a time where we don't understand the slippery slope. And if we take the money, let us not waste each other's time. Let us agree and say that, you know, money can be very tempting. We all want it. You know, what do young people say? We all want to secure the bag. And let us understand, but we can't use the language of we want to regulate, we want to use legislative power, but as a government, we will take money from the alcohol industry. Absolutely. There's no free lunch.
Right. No free lunch indeed. Thank you for those reflection, colleagues. I don't see any more questions in from our participants. And I do want to thank all of you for joining us today. I think this has been a very exciting conversation, and I think there's a lot of issues that require some sort of follow-up and maybe tighter, you know, more focused conversations to take forward. I think it is unfortunate that government was not represented, but we're hoping that, you know, SAPA can at some point draw government into this conversation so that we ask the very questions that we've been asking. I think for me, one of the most important takeaways from this conversation has been how we need to empower communities, you know, how, you know, we need to empower communities to understand and decipher what is happening, but also to be able to, within their locale and remit, understand how they can influence a lot of these issues. Because I think when we talk about our constitution as South Africa, and when we talk about you know, social accountability and the role that citizens ought to play, I think we take it for granted that once it's written in a document, it will translate to happening. And we do know that a lot of the IDPs that Lebo was talking about are actually written by, you know, consultants. You know, municipalities get consultants to come and write IDPs, and there isn't any contribution from you know, communities. And I think that is where we need to start, you know, to give communities the tools that they need to be able to influence, you know, at that level, the decision making that happens, because ultimately they are the ones that are affected. I do want to thank my panelists. Thank you, Nelisiwe from the Soul City Institute. Thank you, Lebohang Ramafuku from Tekano. And thank you, Leanne. I'm going to look for your surname quickly. Leanne Ramsuma from the Medical Research Council. And thank you to our partners, the Ford Foundation, the Mail and Guardian, the Medical Research Council, Hlanganisa SAPA, and Sonke Gender Justice. And on that note, thank you very much, colleagues, and have a wonderful afternoon going forward.
Thank you. Thanks, everyone.
Thanks, Bongi.
Thank
Thanks,
you.
everyone.
Thank you, everyone.
Bye.
Bye. Oof. That